The Royal Liverpool and Broadgreen University Hospitals NHS Trust provides specialist services to around 750,000 people across Merseyside, Cheshire, North Wales and the Isle of Man. We are a leading trust in investing in new technologies and innovations that will help improve patient care. This has been a busy and challenging year at our hospitals. We have cared for and treated an increasing number of patients during prolonged periods of high activity across our wards and departments. Throughout the year, our staff have worked extremely hard to meet these challenges, whilst at the same time continuing to deliver sustained improvements. We have continued to reduce infection rates in MRSA and C. diff, and in 2011 we were named as a Centre of Excellence for Infection Prevention. We have reduced unplanned emergency admissions and we have met our targets for both quality and performance, all within a current economic climate of financial constraint faced throughout the whole health economy. Here are just some of our highlights this year.
The Royal are pioneers of innovation, and we continue to invest in excellence to offer the very best treatment for our patients. In 2011, our £1.6 million Da Vinci robot system operated on its first ever patient. Da Vinci is the most advanced robotic surgical system in the world, and we are one of the very few centres in the UK to provide this state-of-the-art service to patients. The robot allows surgeons to carry out complex operations using keyhole surgery. It provides them with greater precision and enhanced dexterity, and for patients a much faster recovery. Many patients have been able to return home within just a day of their operation and have been able to return to work and their normal activities within weeks of their treatment. So far, around 100 patients having surgery for prostate cancer and kidney cancer have benefited from this amazing new service. In June 2011, the first hospital-based static PET CT scanner in Merseyside and Cheshire was opened at the Royal. The £1.8 million state-of-the-art scanner is used to diagnose cancer, check if a cancer has spread and assess the effectiveness of treatments. In December 2011, we unveiled our new high-resolution definition flash CT scanner. With this cutting-edge technology, the whole body can be scanned in under 4 seconds and the chest in less than a heartbeat. Such speed, together with low-dose radiation, provides a faster and easier scanning experience for patients. We have also introduced new hospital case managers into departments and invested in a new hospital case management computer system, the first of its kind in the UK and Europe. Together, they are improving patients' discharge and reducing delays. Case managers monitor and continually assess each patient's progress and recovery throughout their time in hospital. They work closely with the patient, matrons, consultants and community partners to ensure that the patient doesn't have to stay in hospital any longer than they need to and has support when discharged. Alongside investing in innovation, we have worked hard to ensure that our patients receive vital care when they need it most. Our stroke services provide care for patients 24 hours a day, 7 days a week. Staff carry out daily, multidisciplinary team board meetings to review the care of each individual stroke patient. The patient's progress is then plotted onto a board on the ward, and all the staff work to the same goal of helping the patient's recovery. In 2011, our stroke services were rated as one of the best in the country and the best in the North West by the Stroke Improvement National Audit Programme, run by the Royal College of Physicians. During the year, the service achieved our fastest ever door-to-needle time, when it gave vital clot-busting drugs to a patient within 17 minutes of their arrival at hospital. 100 patients have now benefited from this life-saving service. Following a national review of major trauma services, Aintree Hospital, the Royal and the Walton Centre were selected to provide a collaborative service for major trauma cases across Merseyside and Cheshire. This means patients will receive the right care for major trauma at the right place, at the right time and by the right clinician. We have long been at the forefront of the fight against infection, and all staff are trained in hand hygiene and protecting patients from infection. We had just 4 cases of MRSA this year, and the number of cases of C. difficile was reduced by over 40%. In early 2012, we were recognised as a Global Centre of Excellence for Infection Prevention by Johnson & Johnson. As well as taking pride in our low infection rates, our staff have shown great support in encouraging vaccinations against flu and to follow best practice in fighting killer bugs. It's something we feel is worth making a song and dance about. Throughout the year, we launched a number of initiatives to further engage and involve our staff with our values. Over 500 staff attended large-scale engagement events, which discussed our way forward and provided the opportunity for staff to express their views on how the Trust is run. Following this, we're now implementing our Everyone Matters staff engagement strategy. Through working closely with Liverpool's universities, the Royal is also at the forefront of clinical research. In August, our Pancreatic Biomedical Research Unit was awarded £6.5 million by the National Institute for Health Research to continue to develop research work for the next 5 years. The unit at the Royal is the only National Institute unit carrying out research into pancreatic diseases. It's the busiest in the country and it's equipped with the very latest research tools, some of which can't be found for miles around. This means that vital research into acute and chronic pancreatitis and pancreatic cancer will continue to be developed here in Liverpool for the benefit of people both locally and across the globe. The future of the Royal lies in its pioneering partnerships in clinical research, and this is a key element in our plans for the new Royal, with the creation of a biocampus. The project is driven by our partnership with the University of Liverpool, Liverpool John Moores University and the Liverpool School of Tropical Medicine, and is backed by the City Council and Liverpool Vision. The biocampus will create up to 5,000 high-tech jobs in the city and will put Liverpool on the world stage for life sciences. In July 2011, we shortlisted 2 bidders for the new Royal, Carillion and Horizon. We are now carefully considering each proposal, assessing their value for money and how the design will best support patient care. We expect to make our decision by the end of 2012.
All of this could not have been possible without the skills, dedication and commitment of our staff. On behalf of the whole Trust Board, I would like to say thank you to each and every one of our staff for all their hard work throughout the year. This next year will be a pivotal one for our hospitals. We will continue to develop close working relationships with our local partners and those throughout the health economy. We also have a number of major projects to look forward to. We have the new Royal and Biocampus and our collaborative working on the Regional Major Trauma Centre, a formal public consultation on our collaboration with Clatterbridge Cancer Centre and our progress towards achieving Foundation Trust status.